8 psychological disorders you should know about. Your brain is immensely complicated. It's where you make new ideas and fall in love, as well as what controls all of your limbs when you dance or do anything else. Stringy bits of flesh and electrically charged fat, the brain's complexity has evolved into a tightly regimented formation in order for us to undertake the functions of our daily lives. Much like the rest of the body, the brain is subject to disruptions. These psychological disorders can affect the way we function. It's important to understand right off the bat that for something to be considered abnormal, we would need to have a concept of normal function, which could be rather alienating, especially to those who are perfectly happy with the differences in the way they see the world. Therefore, most psychological disorders are described only in the terms of personally negative impact. We've come a long way since the blanket term insanity was acceptable, but the shadow of stigma cast over those of us with mental illnesses and abnormalities is still prevalent. Today, we're going to take a look at 8 psychological disorders you should know about. Number 1. Bipolar. Bipolar disorder is often characterized by shifts in mood and energy levels. Typically, periods of soaring energetic activity, elevated mood and excessive confidence, termed mania, is followed by a depressive episode. These depressive episodes can be like any other, with feelings of guilt, apathy, and irritability. People going through a depressive episode find it hard to enjoy activities they once did and can have suicidal tendencies. Naturally, being in a state of slingshotting from mania to depression can be acutely worrying for the person experiencing it, as well as their loved ones. Luckily, these symptoms can be effectively managed with whatever mix of medication and psychotherapy is appropriate for the individual. Number 2. Trauma. Traumatic events in our life can, unfortunately, have lasting effects on the function of our brains. In much the same way that broken bones sometimes take longer to heal, so does our emotional response system. Acute distress disorder is when a person begins to experience severe anxiety for up to a month following witnessing a traumatic event. They may begin having dissociative symptoms, flashbacks, and a difficulty feeling positive emotions. Post-traumatic stress disorder, or PTSD, is more long-term. After experiencing a direct threat of death, serious injury, or sexual violence, people are naturally going to have to deal with a lot of psychological fallout. Nightmares, flashbacks, bursts of anger, difficulty concentrating, exaggerated startle response, and difficulty remembering aspects of the event are just a few possible symptoms that people with PTSD might experience. Talking therapy and medication can help these people return to a pre-traumatic mental space. Number 3. Disassociation. Disassociation is the term given to disorders that interrupt our consciousness. No, not wakefulness. A person disassociating is still very much awake and active, but they might not actually be aware of the world around them. It can affect a person's sense of identity and memory. Dissociative identity disorder, formerly known as multiple personality disorder, involves the presence of 2 or more different identities or personalities. Each of these personalities has its own way of perceiving and interacting with the environment. People with this disorder experience changes in behavior, memory, perception, emotional response, and consciousness. Depersonalization, derealization disorder, is characterized by experiencing a sense of being outside of one's own body, depersonalization, and being disconnected from reality, derealization. People who have this disorder often feel a sense of unreality and an involuntary disconnect from their own memories, feelings, and consciousness. Number 4. Eating disorders. The consumption of food has a lot of complicated effects on mood, as well as physical health, and also has a lot of societal factors linked to it. Eating disorders can be anything from an unhealthy amount of overeating or undereating to specific pathological aversions and obsessions. Anorexia nervosa is characterized by restricted food consumption that leads to weight loss and very low body weight. Those who experience this disorder also have a preoccupation and fear of gaining weight, as well as a distorted view of their own appearance and behavior. Bulimia nervosa involves binging and then taking extreme steps to compensate for these binges. These compensatory behaviors might include self-induced vomiting, the abuse of laxatives or diuretics, and excessive exercise. Rumination disorder is marked by regurgitating previously chewed or swallowed food in order to either spit it out or re-swallow it. Most of those affected by this disorder are children or adults who also have a developmental delay or intellectual disability. Additional problems that can result from this behavior include dental decay, esophageal ulcers, and malnutrition. Pica involves craving and consuming non-food substances such as dirt, paint, or soap. The disorder most commonly affects children and those with developmental disabilities. The binge eating disorder involves episodes of binge eating where the individual consumes an unusually large amount over the course of a couple of hours. Not only do people overeat, however, they also feel as if they have no control over their eating. Binge eating episodes are sometimes triggered by certain emotions, such as feeling happy or anxious, by boredom, or following stressful events. Number 5. Anxiety. A level of anxiety is persistent in all of us and is a useful and important part of our mental process. Unfortunately, sometimes the specifics and scale of fear and worry can interfere with a person's life. Generalized anxiety disorder is marked by excessive worry about everyday events. While some stress and worry are a normal and even common part of life, GAD involves worry that is so excessive that it interferes with a person's well-being and functioning. Social anxiety disorder is a fairly common psychological disorder that involves an irrational fear of being watched or judged. The anxiety caused by this disorder can have a major impact on an individual's life and make it difficult to function at school, work, and other social settings. There are many ways of overcoming anxiety, including talk therapies, lifestyle changes, and medication. It is one of the most common forms of psychological disorder, and there's a good chance that you or a loved one suffers from it. Number 6. Depression. As I'm sure you're aware, depression is more than just a synonym for being sad. It is characterized by the long-standing presence of empty, irritable, sad, and generally apathetic moods. The causes of depression are varied and often compound. Certain chemical imbalances might trigger depression, but so can environmental factors. Some are born with it, some develop it, and no one is immune to it. Major depressive disorder, a condition characterized by loss of interest in activities and depressed mood which leads to significant impairments in how a person is able to function. For major depressive disorder, diagnosis requires an individual to experience 5 or more of the following symptoms over the same 2-week period. One of these symptoms must include either depressed mood or loss of interest or pleasure in previously enjoyed activities. Symptoms can include depressed mood for most or all of the day, decreased or lack of interest in activities the individual previously enjoyed, significant weight loss or gain, or decreased or increased appetite, sleep disturbances, insomnia or hypersomnia, feelings of slowed physical activity or restlessness, lack of energy or fatigue that lasts most or all of the day, feelings of guilt or worthlessness, difficulty thinking or concentrating, preoccupation with death or thoughts of suicide. Treatments for depressive disorders often involve a combination of psychotherapy and medications. Number 7. Schizophrenia. Schizophrenia is a chronic psychiatric condition that affects a person's thinking, feeling, and behavior. It is a complex long-term condition that symptoms can be completely life-altering. To be diagnosed as schizophrenic, you need to present 2 or more of these symptoms for at least 1 month. Delusions or beliefs that conflict with reality. Hallucination, whether that's seeing or hearing things that aren't actually there. jumbled or disorganized speech that do not follow the rules of grammar. Schizophrenia usually begins to show itself during the late teens or early 20s, and men usually show their symptoms earlier than women. Many factors could cause schizophrenia, from genetics and general brain chemistry to environmental factors and substance use. Number 8. Personality disorder. Your personality is what makes you, you. Some aspects of brain chemistry and wiring can cause someone's personality to be extremely detrimental to their life and relationships. These personality disorders could be: an antisocial personality disorder is one characterized by a long-standing disregard for rules, social norms, and the rights of others. People with this disorder typically begin displaying symptoms during childhood, have difficulty feeling empathy for others, and lack remorse for their destructive behaviors. Avoidant personality disorder involves severe social inhibition and sensitivity to rejection. Such feelings of insecurity lead to significant problems with the individual's daily life and functioning. A borderline personality disorder is associated with symptoms including emotional instability, unstable and intense interpersonal relationships, unstable self-image, and impulsive behaviors. Dependent personality disorder involves a chronic pattern of fearing separation and an excessive need to be taken care of. People with this disorder will often engage in behaviors that are designed to produce caregiving actions in others. A histrionic personality disorder is associated with patterns of extreme emotionality and attention-seeking behaviors. People with this condition feel uncomfortable in settings where they are not the center of attention, have rapidly changing emotions, and may engage in socially inappropriate behaviors designed to attract attention from others. Narcissistic personality disorder is associated with a lasting pattern of exaggerated self-image, self-centeredness, and low empathy. People with this condition tend to be more interested in themselves than with others. A paranoid personality disorder is characterized by a distrust of others, even family, friends, and romantic partners. People with this disorder perceive others' intentions as malevolent, even without any evidence or justification. Schizoid personality disorder involves symptoms that include being detached from social relationships. People with this disorder are directed towards their inner lives and are often indifferent to relationships. What do you use your brain for? Where has it taken you today? It's clearly taken you here to expand your understanding of it. But it could also take you to the comments to start a discussion. What psychological disorder did you find the most helpful learning about? Like this video and subscribe for more content for your curiosity.